So, good afternoon, everyone. I will request everyone to switch on the cameras, please, for today, so that we can have one screenshot. Great. Hello, madam. And good. At least I have someone to give physical certificate to Sunny.
Hello.
For the rest of the, it will be, more of e-certificate and this thing. But you will receive your certificates by courier within India. Outside India, it will be difficult to do the couriers. And so, me start this.
Recording in progress.
Trying to, yes. So if you can switch on the, everybody can switch on the cameras, please. Yes, thank you. Yes, yeah. Okay. Yeah. And let me have another screenshot with this. Okay.
Hello, ma'am.
Hello.
Hello.
Uh,
Hello.
how are you? कैसे हैं आप?
Fine, sir. Fine.
चलिए बढ़िया. So, few of the feedbacks. So, Dr. Jyoti, you start, then Dr. Hemant and Madam can tell, and then Dr. Sheena has already told, and we'll take it from Dr. Parminder, from Dr. Harsh, Dr. Kayur. Very short, your feedbacks, and then we will start with the, we will hand over the certificate to Sunny, and as he was first, so he will get a gift hamper also. So, and then we will give it to second, third position holders also. I will courier it from with the certificate, and then you will all receive your certificates for your course. So, I think so we do have your addresses. Otherwise, Pravesh will contact you for your addresses, and then he will courier your. He already has, because he has couriered the books to you. So that is there in our list, in our data. So he will courier the certificates to everyone. Yes, Dr. Jyoti, we start with you.
Yes, sir. First of all, I would say I have already written in the chat box. This is one of the best training I have ever got, right from MBBS, my PG, post graduation, super specialty training throughout. So I could learn. You are a born teacher, sir. Actually, whatever you tell from basics to advanced, you explain it such a way that even a beginner will understand the basics as well as the advanced echo reviews, theory part. So it was indeed a well advanced training. A 6 months course, you'll be able to understand the views, see, and all aspects of functional echo has been explained in a beautiful, simple way. That is what I would like to tell you. And your teaching, I was telling Naveen sir also. for a beginner like me, if it is so useful, I can do echoes and helping our babies. It has helped in a much better way than previously. Last 6 months, maybe 3 months after the hands-on session, that hands-on training was extremely helpful. And after getting that hands-on training, I came back. I could do, and I was getting views, and I could save, I would say, minimum 3 babies because of my hands-on experience and my echo training with you, sir. Like that is the best part, I would say. And indeed, I am a clinician and not an academician. So I would be wanting to do the best for my babies. So that for that I am extremely grateful to you. Now I have started teaching students. Everybody is keen to learn, and that also I learned how to tell everything in a simple manner. Previously, this echo, whatever we learn, even from books or other videos, it used to go over our head. It was nothing was going into. We were not understanding it properly. So now they have also started doing, and they are getting the views. And so extremely grateful and thankful to you, sir. Anyway, we'll be keeping in touch with you, whatever difficulties, if we, any difficulty I have in further echo views or understanding the diagnosis, I'll definitely keep in touch with you. And all the best for you also, sir. Wishing you in my prayers, you'll be there. And this should continue to each and NIC or all nooks and corners of India, as you have written in your brochure. This should go, and it is indeed going to help a lot and save many babies. Thank you very much, sir. Thank you very much.
Thank you, Dr. Jyoti. Thank you very much. And yes, you have taken up a very important aspect. One, as you told, with this, you get an extra mileage to, to intervene into the babies. And the other thing is the hands-on component is very important. Very important. Thank you very much. And Dr. Hemant, madam, your feedbacks.
Hello, sir.
Hello, madam.
First of all, I am very thankful that you allowed me as a gynecologist to join this session. And sir, as a gynecologist, I was already doing level 2 ultrasound and NT scans. So by doing this course for my husband, of course, he is a pediatrician. I have got myself at par in my level 2 echo views. So earlier in my fetal echoes, I was giving only 8 basic views. And now after the good understanding of fetal heart anatomy, now I can judge all the 16 that basic and advanced echo reports. And for my husband also, sir, I was 0 for fetal echo, 0. I was not, मतलब बच्चा को तो हम देखते ही नहीं थे sir. But after you taught, I could generate all the views because you taught so nicely sir. जगह जैसे हाथ पकड़ के आपने ना probe कैसे रखना है, कहाँ रखना है, एकदम उस प्रोटोकॉल को फॉलो करते हुए ना सर, अब बहुत सारी डायग्नोसिस बहुत इजी हो गई है और अपने हस्बैंड को हम बहुत हेल्प कर पाते हैं अब उनके ट्रीटमेंट में, मेरे हस्बैंड सर.
बढ़िया. Great.
For every teeny things, I used to call cardiologist in my NICU. And now I put baby on the machine and I do it myself after doing this course. This is very helpful to me.
Sir, we had 2 ultrasound machine, one for me and one for him. But he used to call the cardiologist in his NICU. But now he calls me first hand.
First hand I do it myself.
And first he does it himself, then he calls me, then we decide whether we have to, if there is any congenital heart disease and we have to give any report, then we call the cardiologist. So this course was wonderful. And as Jyoti ma'am told me, this is the best course. The best part, sir, I could learn at the comfort of my home. I could ask so many questions. Whenever I was not understanding anything, I just interrupted. Sir, I had a question. And you were so polite in answering all the questions, like all the doubts you always clear. Sir, इससे बेहतर teacher नहीं हो सकता. तो बहुत सारे टीचर से पढ़े थे, बहुत डर लगता था पूछने में, बट आपसे तो सर कभी डर नहीं लगा नहीं कि आप डांटोगे कि डिस्टर्ब कर दिया, वैसा कुछ नहीं. बहुत सीखा सर, थैंक यू सो मच सर।
थैंक यू मैडम। और इट वाज एनकरेजिंग फॉर अस कि हमारे लिए भी कुछ ऐसा रहा कि कुछ हमारी लीग से लाइन से हट के कोई आया। एंड आई वाज जस्ट थिंकिंग कि मैं आपको कितना यूजफुल ये रहेगा, बट एज यू हैव टोल्ड इट इज वेरी एनकरेजिंग फॉर अस आल्सो। थैंक you very much.
I always switched on the video because my husband used to sleep in the course, and so I always kept the video on so that he couldn't sleep and he could also study with me.
Very nice.
So much sir.
Great, great. Thank you very much, Dr. Harsh.
Hello, sir.
Hello.
Sir, I have no words, sir. Everybody has said more than enough, sir. I would rate it 100 out of 100. Course was really excellent. And the method of teaching was very smooth, sir. I never found any difficulty learning any topic. Uh, the level of understanding for us was very simple. So that was the really nice point, sir. Even in the demonstration session, you showed us everything very nicely. We are not finding that difficulty in our regular practice also. And plus, I am finding myself a better intensivist after doing this course.
So yeah, one thing I just wanted to have feedback from everyone. I will put on the feedback form also, and this is regarding the demo sessions, because most of the people they told that it is, but few people told it may not be useful because the receiving and how you are receiving it, how you are seeing it. So I just want to have a feedback that demo sessions which we do, are they useful for everyone? The live demo sessions what we do, are they useful?
Yes, sir.
Yes, sir, definitely.
These are very useful.
This is because most of the when we many courses are there, many people they do it, nobody keep the live demo sessions because they take lectures and do it. So but I personally feel the lectures is one part, and to do the demo and show them live on the baby is another part. That gives more sense, more connect. So that's why I thought of introducing the demo sessions. Initially, people, many at many platforms, they were resistant to this. So I just wanted to have a feedback from every batch, whether they are useful or not. If they're not useful, then I should decrease it or take it off. If they are useful, then it has to be continued. So that's why I really wanted the feedback from the receiver's point of view. So if it is useful, yeah, so then we will continue, because I wanted the similar, I introduced a similar pattern in the NNF workshops also. So initially there was a resistance because it needs an extra effort for live demo. But I thought that it is useful for people who are learning.
So it's very useful. Okay, at least by a live demo session, we learn how to hold the probe. We are beginners only, na?
Sir, I have. Hello, sir.
Yes, please, Dr. Shiv.
Sir, are you thinking of conducting an examination or something like for the future batches? Because I think to some extent, if there is a small exam or maybe a practical exam kind of thing, then we take all classes more seriously, and
So
I
yes,
think I mean exam is a good thing.
So I have a plan for that. I had a plan for your batch, but then I thought if I keep it at one place, so I don't know if the like most probably I would keep it at Surat. So if I make it compulsory, whether the people will come or they will not come. So I thought once, like suppose university give me 10 seats. So at least for 10 university seats, it will be compulsory like that. So I thought, yeah, this is very good feedback. And I always thought, because when I did my first course of 3 months, like, in Australia, they started, now they are doing CCPU. So I was the first batch student of that CC. In the starting, it was of 3 months. So there was an exit practical exam. They used to give 3 cases. 2 normal and 1 abnormal cardiac disease baby, and you have to do an echo for that. And Martin Klukov used to be there and used to assess and then sign off. So that's how that. So similar pattern. Else everything is almost very similar what they do in this Australia CCPU training program. Now it is of 1 year. My all pattern is very similar to that, because this is how I was trained there. And except for this exit exam, because I always thought I should keep it, then few people they told, I asked also, they told like it will be difficult for us to come over and appear for the exam. So, but yes, that thing is still there in my mind. So that's why I was just thinking to keep some neutral, common place. But again, the hospital, like I'm in the process of getting in, attaching with the different hospitals. Once that thing will done, it will be zonal. So each zone will have one center of NfECHO. So there we can conduct zonal exams. Like zone wise, we'll call and do the exit assessment. So most likely from next, this batch, it won't be possible. But yes, in the end, by December, January, this thing will be there in practice. It will be there. So yes, thank you.
So will we be eligible for that? Like if it maybe after few months, if you're thinking of an exam, so
Yes,
will we be
if you are
eligible?
interested for assessments, anytime, if you are most welcome. Anybody is welcome.
Thank you so much. Sir. Thank you.
Sure. Dr. Rajesh.
Sir, I'm actually it is a very wonderful program, sir. Like even though I'm occupied with many other programs and teaching, I am working as associate professor. But actually, this even though I'm a little bit having a busy schedule, but I try to like whenever the schedule is there, I leave all my patients and I will sit and I listen to it. If I am unable to join, I am doing the lectures, sir. Whatever the recorded lectures, it is actually very helpful, sir. Whatever the demo you are doing, it is like a second time revision, sir. If sometimes theory class is being missed also, like it will be having positive impact. This demo session needs to be continued, sir, to further batches also. Regarding exit exam, this is a continuous process, sir. Whatever we had taken, it is a gist of it. So hands-on experience. So it will be like a continuous learning process. It will be we need a continuous direction from you and help from you whenever we are dealing with echoes or ultrasounds whenever we are having any doubt or queries we can take your help and also our colleagues help so that it will be a continuous learning process, sir. We cannot say we are masters by now, but it is a continuous learning process which need to be continued. That is my my opinions.
Thank you for this and bringing up this point. Yes, group will be continued. Everybody, whatever you are doing, if you find it is interesting, share with everyone. If you find some difficulty, put it in the group, ask the questions, discuss. Even many people, if it is not cardiac, non-cardiac also, they will discuss. So that is good. At least you have some platform where you have like-minded people. We can all discuss with each other. And learning is a continuous process. Still, I'm learning. So still, I'm like in the process of doing my PhD. So it will never stop. I still say like whatever still I would say from eco and hemodynamics point of view, 15% of the things I would know, 85% I don't know. So it is a continuous process. Everybody has to learn from each other. That is very important. This group will continue. I will keep on posting the things. You keep on posting the things. And whenever you feel difficulty, you can, ask any one of the group. You can ask me. So surely we are there because we are there as a family. We will interact and we will learn from each other only. That is what it is. So yes, great.
And I am grateful for you, sir, for being for giving me this chance and also the way you you taught us, and it is almost like a rocket science before I joined this course. But now I feel like it is simplified. You made it so simplified that we can do it. So the way you taught is very excellent, sir. And we try to practice the same when we are teaching to our students also. The everything, the guidelines are too good, sir. Thank you, sir. Thank you for everything.
Thank you. Dr. Vinod is there? Yeah, Dr. Vinod. Dr. Purvasha.
Good afternoon, sir. So, sir, I wanted to just specify that apart from like attending lectures, hands-on was very good, sir. So, because as I had some basic knowledge also, still there was a lot of fine-tuning which was done by you, and you personally supervised all of us, sir. So that was one of the good things, sir, in this workshop. And apart from that, and also because your lectures also were
Aapka mute, you got mute.
basic things like the view, basic view should be correct so that all the calculations are also correct. So that was also a very good thing, sir. And exactly how to calculate all the parameters, that also you explained. So overall, it was very nice, sir. Thank you so much.
Thank you.
And that's it.
Thank you. Dr. Dhaval. Dr. Niloy. Unmute, please unmute.
Good afternoon, sir. Thank you, sir, for choosing me in this course. Initially, I was very apprehensive whether this complex thing will go above my cortex or not. But it is your teaching in such a lucid way. It is very much interesting. Also, the interactive course. Now I am confident that I can do it, and it is now become a part of daily routine also. Thank you, sir. And it is three things I will miss. One is your teaching. Second is the interaction of all the members, and last but not least the count session. Count session was really interesting, sir.
Great.
Thank you, sir.
So it means we should continue with the count, isn't it?
Yes, sir.
Okay. Good. And from my wife, she is basically a ISKCON follower. And one of her ISKCON followers, they have classes in ISKCON, this thing. So I saw Kahoot there first. So they had this multiple question on Bhagavad Gita because they do lectures and courses on Bhagavatam, and they conducted Kahoot there, and I saw Kahoot there. Then I got an idea. Okay, this is the same thing we can do in our courses. So I learned it basically from that ISKCON temple teachings. What my wife she attend. So great. Okay, good. Someone with Reliance iPhone. Yes. Hi.
Good afternoon, sir. Good afternoon, sir. Sir, I would like to say, sir, big thanks to you, sir, for providing us such an amazing and wonderful platform for learning. Sir, it will definitely help us tremendously in managing a sick-born babies, and learning something new and making a diagnosis is always be special, sir. So I think this course will be completed after hands-on training. So, sir, I wish to come for training sooner or later, sir.
Sure.
Your teaching excellent, sir.
Great. Thank you. Dr.
Thank
Kayur.
you, sir.
Thank you. Dr. Kayur.
Good afternoon, sir.
Good afternoon.
सर एज ऑफ माय पॉइंट ऑफ व्यू, मैंने तो पहले ही सोनोग्राफी ऐसा कुछ किया नहीं था या यूएसजी किया नहीं था, तो इट इज फॉर माय फर्स्ट चॉइस. तो मैंने स्टार्ट किया, तो फिर हेमंत भाई से मुझे मिला कि मोहित सर का ऐसा ऐसा कोर्स है, हम ज्वाइन कर लेते हैं, 1 बाय 1 करते हैं या तो फिर साथ में कर लेते हैं. फिर हमने देखा कि चलो साथ में कर लेते हैं तो अच्छे से एडजस्ट भी हो जाएगा और एक दूसरे को हेल्प भी हो जाएगी. सो मैंने तो फर्स्ट टाइम मैंने अपनी लाइफ में पकड़ा था। आफ्टर पीजी के ऐसा कुछ मैंने कोर्स किया नहीं था, तो मेरे लिए फर्स्ट एक्सपीरियंस था, और ये इट इज द बेस्ट एक्सपीरियंस फ्रॉम यू। और मेरे लिए तो आप टीचर बेस्ट ही हो पहले से ही। जो हेमंत सर से सुना है या जो भी सुना है, तो यू आर द बेस्ट टीचर फॉर गाइडेंस, फॉर टीचिंग एंड ऑल थिंग। और फाइन हैंड्स ऑन के बाद तो फाइन ट्यूनिंग इतना अच्छा आ गया कि जो मेरा व्यूज नहीं आ रहा था, जो मैं खुद कर रहा था, तो वो भी बेस्ट हो गया। और यहाँ पे हमने प्रैक्टिस चालू रखी है। और जस्ट हैंड्स ऑन के लिए ऐसा है कि आफ्टर कार्डियोलॉजी सेशन खत्म हो, उसके बाद हैंड्स ऑन हो तो अच्छा हो सबके लिए। उससे पहले आने में थोड़ा दिक्कत रहता है कि फिर वापस सेकंड टाइम भी आना पड़े। तो आफ्टर कार्डियोलॉजी सेशन ही हैंड्स ऑन रखना चाहिए, तो एक अच्छा रहेगा सबके लिए। तो ऑल कैन गेट फाइन ट्यूनिंग एंड आपका एक्सपीरियंस भी मिले वहां पे पर्सनली, तो एक अच्छा रहेगा वो।
Yeah, this is good advice.
थैंक यू सर।
Thank you very much. Anybody there left? Dr. Prabhat.
गुड आफ्टरनून सर। मैंने कलकत्ता में आपका वर्कशॉप अटेंड किया था सर, न्यूकॉन में। एंड वहाँ पे क्लासेस अटेंड करने के बाद मैं काफी दिन से सर्च कर रहा था कि मुझे यूएस मतलब बेसिक शौक के लिए आईबीसी देखना, थोड़ी बहुत चीजें यूट्यूब से सीखी थी, अपने फ्रेंड रेडियोलॉजी से सीखा था। तो आईसीयू मैनेजमेंट में मुझे और फाइन ट्यूनिंग चाहिए था। तो मैंने जब वर्कशॉप वहां अटेंड किया तो मुझे लगा कि नहीं, अब मुझे जो चाहिए था वो मिल जाएगा। तो जाकर नहीं कर सकता था, लेकिन सर आपने ऑनलाइन जो सिखा दिया वो जाने की जरूरत ही नहीं पड़ी। हाँ, अभी मैं आ रहा हूँ सर नेक्स्ट मंथ हैंड्स ऑन के लिए। और ये कोर्सेज सर आपने जो सिखाया जिस ढंग से, लगा कि सर आपने हाथ पकड़ के वहीं से सिखा दिया, जो रिमोट कंट्रोल से इतना अच्छा कोई नहीं सिखा सकता था सर। सबसे अच्छी चीज थी सर कि पहले आप थ्योरी क्लास लेते हैं, उसके बाद उसका डेमो क्लास में जो प्रैक्टिकल होता है ये जस्ट उसके अगले दिन होता है या अगले क्लास में होता है। तो उससे पहले आप पढ़ा देते हैं सर, हम लोग उसको अपने से प्रैक्टिस कर लेते हैं। फिर जब डेमो में देखते हैं तो हमें पता चलता है कि हाँ ये ऐसे हो रहा है। और अभी जो चेंजेस हुआ है सर, पहले से रेडियोलॉजिस्ट जो हम लोगों का अल्ट्रासाउंड करके जाते थे, जैसे अल्ट्रासाउंड क्रैनियम करके गए, नो आईबीएस लिख कर चले जाते थे। अब हमसे पूछते हैं कि भाई हम आरआई हमने देखा है तो इतना है, आप बताइए कि हमने सही देखा है कि नहीं। तो देन दे गॉट इम्प्रेस कि नहीं, आपने ज्यादा देखना शुरू किया है। तो अब उन्होंने फॉर्मेट ऐड कर दिया हमारे रेडियोलॉजिस्ट ने, कि अब वो आरआई बताना शुरू कर दिए हैं। तो इस ढंग से जैसे पीडीए लिख कर चले जाते थे, तो हमने उससे बोलना शुरू किया कि पीडीए का हेमोडायनामिकली सिग्निफिकेंट है कि नहीं, उसके पैरामीटर्स लिखना शुरू करिए। तो दीज चेंजेस हैव हैपेंड। एंड आपने इतने अच्छे से ट्रेन किया सर। अभी हम लोग इस फैमिली में जुड़े रहेंगे, तो हम लोग भी अपडेट होते रहेंगे आपके साथ साथ। थैंक यू सर।
Thank you very much. Okay, we have Dr. Kundan is left. Dr. Kundan.
Good afternoon, sir.
Afternoon.
Sir, you are simply great, sir. Sir, I am doing eco since last 6 to 7 years, sir. And I have done my PG from AFMC Pune, and my HOD was Brigadier Mukti Sharma and Colonel Prabhat. Both were pediatric cardiologists. And whatever I have learned, I was doing little bit of echo since then. And regularly I am attending your workshop, Neocon workshops. And I am a great fan of you. And even though initially I was very hesitant whether we should go for this course or not. Then finally I have decided, and you have also helped me a lot. But especially the functional part is excellent, sir. Excellent, sir. So many doubts that was earlier is now cleared. And you have made it so simple that I can't express so many things, and little bit of doubts I have put forward earlier, and still my doubt is still not clear, sir. You have not given me this clarification, sir. Sir, please, whatever doubt may be childish, maybe my doubt may be childish, sir. Sir, please respond. Please respond is my request, sir.
Actually, last 1.5 months, what happened? I went out to Singapore. Then my daughter's this thing, UG NEET. There's things is because now they made this process of this selection of the colleges so tedious. Like
Yes.
she has cleared NEET, and now we are tense which college we want to take. The choices are
Yes.
so difficult and this thing, so I got stuck in that. So because of that, in the last few months, one and a half month, I could not concentrate on WhatsApp groups. But from now onwards, once this NEET this thing will be over, I will be into this. Sure. It is
Sir,
always
sir,
my pleasure. It is always my pleasure to do that.
sir, that my doubt was PPHN coarctation, PPHN in coarctation of aorta, sir. Sir, please, sir,
Okay, so
clarify.
PPHN in coarctation of aorta, isn't it? So now the thing is, coarctation of aorta is duct-dependent lesion. Okay,
Yes.
there is a critical coct. What happens that the systemic blood is being now dependent on the right side, because from if the duct dependent lesion that is there, left side obstructive, the blood will go from pulmonary artery to the descending aorta. Okay, so your now RV is exposed to systemic circulation, systemic vascular resistance, SVR. PVR is always lower than SVR. So now your
Yes.
RV is exposed to SVR, therefore the pressures in the RV will be against high, because it has to work against SVR, and therefore you will they will present similar way as the PPHN baby. That's why in PPHN also you have to rule out coarctation of aorta.
Sir, sir.
That is the main the most. This is the that's why it is very good question, because I used to also ask people when I used to write PPHN or baby crashing and you have a coarctation of aorta. Why, if it's a left-sided obstructive lesion, then why it will present as PPHN? It
Sir,
presents PPHN because RV is now blood supplying chamber for the systemic circulation, and it is exposed to systemic vascular resistance. That's why the pressures in RV increases.
sir. Thank you, sir. Thank you very much, sir. And wish you all the best, and may God bless you, sir.
Thank you very much.
Your experience, your patience is excellent, sir. I can't imagine. I have not found any teacher like you, sir. Thank you, sir.
Okay, so now the person who is there with me, I will hand over the certificate so that you can see and rest. I will show you, and we will share the e-copy of certificate with everyone today or tomorrow. By today is Eid, so Parvez is on leave today. So by tomorrow he will be sending to everyone your e-certificates, and then once he will join back on Saturday or Monday, he will start courier. He will courier you the certificates. If you have any issues or anything, spelling mistakes if are there, so we will change it in the e-certificate. We will change it. Okay. So I would request now Dr. Sunny to be there, and I'll give him the certificate. कहाँ है इधर है ना? So these are the certificates. इधर उल्टा दिखेगा ना? इधर मैं ई कॉपी कर दूंगा से. किसी को बुला देना, हाँ तू दिखा दे फोटो के लिए. So Sunny is representing everyone. So just consider this, that you all have received your certificates. So thank you very much. Thank you for joining in this group, in this batch, and being with us to be in the family of NfECHO. And we will continue our sharing with each other. And whosoever is in your contact, please try to convey. If anybody is interested, they can do and join. The other thing is, I forgot to bring that. I don't have the soft copies. Today only I have signed one thesis of my one fellow, and her thesis was being done in the first batch also. So the authors of that thesis and that paper, what we will publish, 2 people are there from first batch. So that thesis was on anterior cerebral vein, variability Dopplers of that. So, and there are very few studies on that. Till now, most of the studies, bigger studies, they have the maximum patient was 82. In our study, we had patients, 186 patients. The biggest series now. It could only possible because other 2 centers were also involved. So I am in the process of designing a kind of study, which will be simple for this batch also. I will put it in the group. So whosoever will be interested, they can take up that study. It will be simple. I won't make it complicated. Simple only 1 or 2 variables so that everybody can do. The good thing will be that it will have large numbers. So that will be publication by batch 2. Already by batch 1, one publication is done. Second study is already in process. So that will be great. So I would encourage everyone who is into this, who can do this, at least if they enroll 5-10 babies also, that will be a part of the study, and it becomes, kind of give a publication to one batch and group. So that adds on to the, one, it is good for me also, to the NfECHO, it is good for everyone. And it will be a trend standard, it will start a trend. Whosoever does a course, you can reproduce studies from that. So that is very important. So I will put that. I'm in the process of writing a basic write-up for the study design. So I will share with you all. Whosoever is interested, they can participate. And then there, on 5th, there will be a class of how to read ECG. An inotrope class also I will do, combine batch 1 and batch 2. So, and on Sunday, I will be meeting the pediatric radiologist from USA. So I will be talking to him. Soon we will have a couple of lectures with him. That will be useful and extra what we have already learned. Great. So this is our graduation day. Today we finish that with a big thanks to everyone for being with us, joining with us, being a part of this family. Thank you very much.
Sir, one question.
Yes, madam.
Sir, in the third batch of NfECHO, can we also join in certain topics like PPH and sort of revision will be there?
Kahoot also.
No, not in Kahoot. That will be.
No, sure. You can please, madam, put it in the group if you are interested in that topic. So I will send you the link
Yes.
of the third batch. Sure. No issues.
Yes, sir. Thank you, sir.
Thank you very much. Best
you,
of
sir.
luck to
Thank you
everyone.
so much, sir.
Thank you, sir.
Wish
Thank
to
you,
see you at the
Lord.
next.
Thank you, sir.
Thank you so much, sir.
Thank you.
Thank you, sir.
Thank you.